Hello everyone. So today we're here to discuss about rheumatoid arthritis. So as we can see in image, the right image shows rheumatoid arthritis, bone loss, cartilage loss, bone erosion or bone destruction, and swelling of synovial membrane or synovium. So synovium, they are soft tissue that line the spaces of joint. Here, synovial fluid are also produced. So rheumatoid arthritis, it is a chronic inflammatory joint disease with multi-system involvement. So patient with RA may have anemia, some lung disorder, cardiac disorder. So it is multi-system involvement. So it is a systemic autoimmune disorder characterized by chronic destructive inflammatory arthritis with symmetric joint involvement that result in synovial hypertrophy and pannus formation, ultimately leading to erosion of adjacent cartilage, bone and tendons. So pannus, they are synovial mass with inflammatory cells, granulation tissue, and fibroblast. So etiology unknown, idiopathic, or may be triggered by environmental factor like smoking or infection like mycoplasma, which is atypical organism, and parvovirus B19. So female, they are affected more than male. So the ratio being 3 is to 1. Onset, so during fourth and fifth decade of life, that means 45, 55. Genetic predisposition HLA, DR4. Let's talk about pathophysiology. So first, synovium becomes edematous, or there is swelling of synovial membrane. Secondly, there is increase in synovial fluid. Inflammation may occur and which thickens the synovium. So inflammation, there are release of inflammatory mediators like cytokines, histamine. Eventually, it destroys the cartilage and bone within the joint. Now the tendon and ligament that hold the joint together weakens and stretches. Gradually the joint loses its space and alignment. Let's talk about diagnostic criteria. So there should be morning stiffness for more than 1 hour for 6 weeks, arthritis of 3 or more joint area for 6 weeks, arthritis of hand joint for 6 weeks. Hand joint include MCP joint, PIP joint, DIP joint, and CMC joint. So they are the hand joint. Symmetrical arthritis for 6 weeks. So symmetry means if one knee or any joint is affected, usually the other one is affected too. So rheumatoid nodules. So nodular lump or any outgrowth. Rheumatoid factor positive or anti-CCP positive. So these are lab tests. Radiological changes in joint which are seen in X-ray. So there may be joint destruction. CRP and ESR either positive or increased. So for diagnosis, at least 4 or more should be present to satisfy the criteria for rheumatoid arthritis. So here the score, patient with score of 6 are considered to have definite rheumatoid arthritis. So these are the scoring system. So please go through it. So suppose one large joint is affected, the score is 0. Suppose 2 to 10 large joints are affected, the score is 1. 1 to 3 small joint is affected, score is 2. If 4 to 10 small joint are affected, score is 3. If more than 10 joint, at least one small joint is affected, the score is 5. So for serology, negative rheumatoid factor and ACPA. So ACPA being anti-citrullinated protein autoantibodies. So negative rheumatoid factor and ACPA score is 0. For low positive rheumatoid factor or ACPA score is 2. For high positive rheumatoid factor or ACPA score is 3. Now duration of symptom, if less than 6 weeks, score is 0. If more than 6 weeks, score is 1. So acute phase reactant, so normal CRP and ASR score 0 and abnormal CRP or ASR score is 1. So patient with a score of more than 6 are considered to have definite rheumatoid arthritis. So clinical feature, they are divided into articular manifestation and extra-articular manifestation. So most commonly affected joint are MCP joint, metacarpophalangeal joint, PIP joint, so proximal interphalangeal joint, wrist joint, knee joint, elbow and ankle joint. So there is symmetrical joint swelling with associated stiffness, warmth and tenderness. In hand, some deformities are seen like boutonniere deformity, swan neck deformity, Z deformity of thumb, rheumatoid nodules and muscle wasting. In foot, clawing of toes are seen. So as you can see in first image, boutonniere deformity. So what is seen there is flexion of proximal interphalangeal joint and hyperextension of distal interphalangeal joint. So boutonniere means flexion at PIP and hyperextension of DIP. The second image shows swan neck deformity. So there is flexion of distal interphalangeal joint and hyperextension of proximal interphalangeal joint. Claw toe. So there is flexion at both ends. So flexion of PIP joint and DIP joint in claw toe. And for Z deformity of thumb, there is interphalangeal flexion, hyperextension of metacarpophalangeal joint and flexion of carpometacarpal joint. So the first image showing swan neck deformity and the second one there is rheumatoid nodules or swelling in multiple region of hand and wrist. Extra-articular manifestation like fever, fatigue, weight loss, anorexia, generalized weakness. There may be muscle wasting, osteoporosis, tenosynovitis. So osteoporosis, it is decrease in bone density. There may be symptom like anemia, thrombocytosis, and eosinophilia. Splenomegaly, Felty syndrome are seen. So Felty syndrome, it is rheumatoid arthritis plus splenomegaly plus neutropenia where neutrophil count are low. Keratoconjunctivitis, scleritis and episcleritis. So keratoconjunctivitis is inflammation of cornea as well as conjunctiva. Scleritis, it is inflammation of sclera. And episcleritis, so it is inflammation of episclera, which is the tissue between conjunctiva and sclera. So cardiovascular manifestation like pericarditis, endocarditis and myocarditis. So if all these three are present, they are called as pancarditis. So respiratory symptom like bronchiolitis. So it is inflammation of bronchioles and pleural effusion, which is collection of fluid in pleural space or pleural cavity. Kaplan syndrome. So it is rheumatoid arthritis plus pulmonary nodule. Peripheral neuropathy. So peripheral neuropathy, it affects nerve of hand and leg or upper limb or lower limb, and there may be symptom like tingling sensation, burning sensation, cervical cord compression. So there is compression of spinal cord at the neck region, so cervical region. They are also called as cervical myelopathy. Complication. So articular complication like joint deformation, osteopenia or osteoporosis, and osteoarthritis, anemia, carpal tunnel syndrome. So carpal tunnel syndrome, it occurs due to entrapment of median nerve at wrist joint. Amyloidosis, so there is abnormal deposit of amyloid. Nephrotic syndrome, so proteinuria may be seen. Localized or generalized lymphadenopathy, so localized, at least one lymph node are affected. For generalized, more than 2 lymph nodes should be affected. So lymphadenopathy, they are enlargement of lymph node or swollen lymph node. There may be lymphoma if persistent lymphadenopathy, which is more common in patients with long-standing rheumatoid arthritis. Cardiovascular disease, there may be pancreatitis, vasculitis, and lung fibrosis or pulmonary fibrosis. Other complications are Kaplan syndrome and Felty syndrome plus Sjogren's syndrome. So Sjogren's syndrome, it is keratoconjunctivitis. There may be dryness of mucous membrane. There may be parotid enlargement bilaterally, and they are always associated with rheumatoid arthritis. So this is also an autoimmune disorder. So investigation, X-ray are done of the joint which is affected. There may be reduced joint space, erosion, soft tissue shadow due to effusion, deformities of hand and fingers. In blood, CBC is done. So hemoglobin, TCDC, ESR and CRP are done. Hemoglobin, it is low. ESR may be high. Rheumatoid factor, they are positive. And anti-CCP, they are positive. Synovial fluid analysis should be done, and arthroscopy is done to see the destruction of joint or any abnormalities in joint. So arthroscopy, it is endoscopic visualization of interior part of joint or inside the joint. Treatment. So general measures, short-term bed rest for about an hour in mid-morning and mid-afternoon. Active exercise and hot bath. Correction of anemia by iron supplement, or if anemia is severe, blood transfusion should be recommended. Rest in splint. Intra-articular corticosteroid injection. So methylprednisolone acetate 20 to 80 mg is given in large joint and 4 to 10 mg in small joint. So medical treatment, NSAID are given like ibuprofen, diclofenac, indomethacin and naproxen. COX-2 inhibitor are used like aceclofenac and celecoxib. DMARDs or disease modifying anti-rheumatic drugs like methotrexate, corticosteroid, hydroxychloroquine, sulfasalazine are used. For second line agent, TNF inhibitors. So TNF inhibitors like infliximab, etanercept, adalimumab, they are used as TNF inhibitors for rheumatoid arthritis. Rituximab, so it is anti-CD20 drug, and leflunomide. For immunotherapy or immunomodulation, the treatment of disease by activating or suppressing the immune system, example being azathioprine, cyclophosphamide, cyclosporine. For surgical treatment, soft tissue release, tendon repair, synovectomy, that is removal of synovial membrane or synovium, osteotomy, so there must be cutting of bone by osteotome, arthroplasty, which is repair of joint, joint replacement, or arthrodesis, So arthrodesis, it is joint fusion surgically, and for rehabilitation, physiotherapy should be done. So now let's talk about common MCQs asked in rheumatoid arthritis. So DIP joint is sparred in RA but is involved in osteoarthritis. So DIP joint, they are not involved in rheumatoid arthritis. Felty syndrome, and they are rheumatoid arthritis plus splenomegaly plus neutropenia. Kaplan syndrome is rheumatoid arthritis plus pneumoconiosis and lung nodule or pulmonary nodule. Most specific test for rheumatoid arthritis, it is anti-CCP antibody. The next question, polyarticular rheumatoid arthritis, it is diagnosed when more than slash joint are involved. So more than 5 joint should be involved, or at least 5 joints should be involved. RA, it is a type 3 hypersensitivity reaction. Rheumatic fever is type 2 hypersensitivity reaction. So HLA associated with rheumatoid arthritis is HLA-DR4. Rheumatoid factor, they are antibody. If there is no option of antibody, go for glycoprotein. Pathognomic or pathognomonic feature of rheumatoid arthritis is rheumatoid nodules. Rheumatoid factor in rheumatoid arthritis is important because RA factor is associated with bad prognosis. So indication of systemic steroid in RA is mononeuritis multiplex. So what is mononeuritis multiplex? So they are mostly due to vasculitis, and it is a type of peripheral neuropathy. So it damages different nerve areas. So if the patient present with this symptom, systemic steroid are prescribed. The last one, windsweep deformity. So they are always seen in rheumatoid arthritis. If there is no option of RA, go for rickets. So what is windswept or windsweep deformity? So the joint, knee joint. So one knee joint exists in valgus deformity while other shows varus deformity. So it is like wind sweeping deformity. So that's all for today class. So please subscribe and press the bell icon so that if new videos are uploaded, you will be notified. So thank you.